Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Participants at a gender-based violence conference in Kaduna State chart way forward for women and girls after abuse during the lockdown months. "100 medical students enroll at First Federal University of Health Sciences, solely dedicated to training doctors in Benue State. And Germany considers more measures to curb COVID-19 as it records close to 34,000 cases in 24 hours. The World Health Organization has approved India's COVID vaccine for emergency use. The health agency said the vaccine is extremely suitable for low and middle-income countries due to easy storage requirements. Mariangela Simao, WHO's Assistant Director General for Access to Medicines and Health Products, said the emergency use listing expands availability of vaccines, which is necessary to end the pandemic. Meanwhile, over 5,000 cases of COVID-19 are currently active in the country. The Nigeria Center for Disease Control also confirmed 209 new cases and 1 death, which puts the death toll at 2,900 recorded in the 36 states and the FCT. The 209 new cases are reported from 12 states. Here's a look at the virus update.
109 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 11 states and the FCT and indicate a rise from the figures reported 24 hours earlier. Gombe State recorded 109 cases. The FCT and Rivers States both reported 21 cases, while Lagos recorded 13. Bauchi, Ondo, and Plateau states led the single-digit parade with 9 cases each. Enugu had 7 cases, Benue 5, and Oyo came in with 4 cases. Ekiti and Ogun states had 1 case each. No cases were reported in 4 states, Delta, Edo, Kaduna, and Osun. The total caseload in Nigeria has risen to 212,359. 486 patients have been discharged in the last 24 hours, increasing the total number of recoveries to over 204,000. There was 1 additional death from COVID-19 complications reported in the last 24 hours, raising the total number to 2,900. Currently, there are more than 5,000 active cases in Nigeria, while over 3.3 million samples have been tested. The latest data from the National Primary Healthcare Development Agency shows that more than 5.7 million Nigerians have received a first shot of a COVID-19 vaccine, while over 3 million persons have been fully vaccinated. Globally, more than 7.1 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 218,000 deaths recorded across countries on the continent. More than 248 million people all over the world have contracted COVID-19, while deaths are over 5 million.
The Medical and Dental Council of Nigeria has approved for the first time 100 students for admission at the Federal University of Health Sciences, Otukpo, in Benue State. The approval is coming on the heels of a shortage of medical doctors in training. President Muhammadu Buhari has also approved Otukpo General Hospital as the institution's take-off teaching hospital, a necessary requirement for the deliberate government policy to bridge the gap.
Members of the Governing Council of the newly specialized Federal University of Health Sciences, Otukpo, established in 2020 by President Muhammadu Buhari, arriving the Otukpo General Hospital, the approved facility as teaching hospital for the institution. They meet with the medical officer in charge who conducts them around the facility and converse briefly before convening at the temporary takeoff site in Otada, Otukpo local government. Medical students who gained admission are seen going about their registration while activities are in top gear for the session as the Vice Chancellor meets with journalists.
We have a permanent site at Akwiti Akpa, and we have started the process. As a matter of fact, the drawings of the buildings that we're going to start with, administrative building and the College of Medicine, we have finished the drawings, bill of quantity submitted to TEFON and approved by TEFON. So construction will start almost immediately. What we are waiting for is the processes, because you have to follow the due process.
Against the Medical and Dental Council benchmark of 50 students per college for a single academic session, he explains the institution was able to get 100 slots due to its establishment mandate.
Usually, and as a member of council myself, the maximum they can give, Medical and Dental Council can give to any college is 50, no matter how well equipped your facility is. However, my argument is that this is a medical university. It's not a college. So they've given us 100.
Director of Academic Planning, while explaining the distribution of the 230 students in 9 programs, says the institution will take no chances in producing good medical doctors.
Okay, how are you?
At about 230 of them, because registration is still going on. I'm hoping that the number will be more. But at my last count before this, meeting, we have 230 fully registered students. I am almost sure that there are a lot more, or a few more in the middle.
The institution is set for inauguration on Friday, with host community Otada in Otukwo now reaping the gains of semi-urban and economic activities.
Last month, the Lagos State government approved the sum of 6,000 naira for the administration of vaccines against coronavirus infection at private health facilities in the state. Governor Babajide Sanwo-Olu made this known while declaring open the state's mass vaccination campaign, expressing the government's desire to have a minimum of 4 million residents vaccinated by the 25th of December. The vaccine to be administered by the approved 400 private health facilities alongside the public centers are to be the same that have been sourced by the Nigerian government through donations and various other means. Well, joining us to talk more about this is Dr. Doyin Ogunyemi, a public health physician. She joins us virtually. Thank you for joining us on the program.
Thank you for having me.
All right. I'd like to begin. Are you in agreement the sum of 6,000 naira for COVID-19 vaccines for private healthcare facilities?
Well, let's start with why private sector involvement. We're told private sector involvement so that people who ordinarily would not go to the public health facility can get the vaccine. So it's called an administrative charge, but again, when we look at vaccine equity, we're actually talking about fair access, just access to all. So this administrative charge and the use of private facility, while it has its own advantages because you're allowing access to more people, but the real question then is what sector of more people is most likely going to be the elites that would have that access. Though it allows private sector to also strengthen its capacity, there's the advantage that they would also learn other things around the vaccine and be able to provide service. However, I don't see the balance in the sense that the other socioeconomic class, the lower class, is unlikely to want to pay that amount to get the vaccine. So what are we doing in trying to get more people vaccinated, 4 million people vaccinated? What are we doing to get that set of people? Can we also look at other incentives that can encourage such people to come on board? So the other fear I see is that private sector seems to have better efficiency, maybe lower waiting times. And I worry that we do not have a scarcity for one reason or the other. The state government has said that this is in addition to what will be happening in the public facilities. But we remember how testing went when it went most private. It became a very expensive and unreachable sort of, and that is what we must avoid at all costs. those in the public facilities, the health workers, they already have their own duties apart from the COVID work they're doing. So there must be additional staff and everything they require to ensure that they meet up, so that we do not have a case of iniquity and access to only those that can afford it. As regards the cost, I don't know what was added together to get that cost. I would think that is a bit on the high side, considering that it came completely free. However, I'm more concerned in ensuring other incentives, like giving people 3 days to be able to get the vaccine, or getting some palliatives, whatever that is, for coming to get the vaccine. That will be more attractive to lower income socioeconomic group, and they would likely want to get it. More importantly is confidence, in building the trust of people in getting the vaccine, and that's what we should continue to do. Let's also not forget the non-pharmacological interventions, which remain important, because the vaccines as we have to achieve herd immunity is still a long way to go. We continue to give it, but at the same time, we must remember the non-pharmacological interventions to ensure that people don't come down with the disease. Yeah.
And there's also the angle of vaccine hesitancy. I mean, there is still a fair amount of people who are hesitant to take the vaccine. And then, you have this price tag for private facilities. I want us to talk about the mass vaccination efforts of the state government. The governor was saying to sort of put an end to the third wave and avert a fourth wave. The mass vaccination drive, and that is vaccinating 4 million people before December 25. I mean, do you think this is practicable?
Well, I mean, we've been able to, more or less kick out polio by doing a lot of mass vaccination activities. And so if we really do mean business, we can do it. But I'm not sure that this approach of payment in private facilities is enough to achieve it. Like I've said, it seems one-sided, the group of people that would target. So if we must achieve it, we must look at other ways. Do we want to, because there are a lot of people that are just undecided. Yeah, we have those that are hesitant, but they are not refusing. They just need a little more information, a little more attraction, and then they will get the vaccine. So the styles we have used in other vaccines should also be employed, including mobile vaccination sites, including giving of even financial incentives, if need be, albeit minimal, to just ensure that more people come for the vaccine. But we can achieve it with the number of facilities that we have, both public, private, and all the facilities. It is achievable.
Let's look at the cases that we're also seeing, the case numbers. Are you confident that the state government's efforts are indeed, reducing and fighting the virus? Because if you look at the numbers, I mean, today it was, Lagos wasn't top, but several other states have been recording cases and reporting numbers. Do you think that we are succeeding in fighting the third wave?
Well, at the moment, even with the cases, it has dropped when we compare it to the peak of it. So I think that we don't even expect so many cases at this time. The next time we expect a lot of cases is probably in December, and hence the rush to get people more vaccinated. Again, I still see that with a lot of gatherings and meetings, we're beginning to put down our guards in terms of using our face mask and the other things. And the vaccine does not prevent people completely from getting the virus. It only prevents, severe diseases. So we must go back to those things and continue to talk about use of face mask, wash your hands, apart from getting vaccination, and of course to continue to encourage people to get vaccinated. So we should keep our eyes on the number, and particularly for the fourth wave that is being predicted, and do everything. We have only about 550,000 in Lagos that have had 2 shots, so going to 4 million is quite a number. But Lagosians, there are many, and they're in different areas, different parts, and so we need to be multi-strategic in ensuring that we reach all of those areas and everybody that is eligible to be vaccinated.
We appreciate your time on the program. Dr. Doyin Guyemi is a public health physician. Many thanks for joining us today.
Thank you for having me.
Well, still to come, we have more stories. A turning point in the fight for COVID-19 in the U.S. We have that and more when we return. Welcome back. The U.S. has approved the vaccines for children ages 5 to 11. The U.S. Center for Disease Control said that children in this age group could begin getting shots as soon as this week, as health providers can start vaccinating them as soon as possible. President Joe Biden has called it a turning point in the battle against COVID-19. Our correspondent in Washington, Maria Bird, reports.
The United States gives the first group of kids ages 5 to 11 COVID-19 vaccines on Wednesday. The vaccine for children is a third of the adult dose and a two-part series of shots that are to be taken 21 days apart. Over 2 million children have been impacted by COVID-19 since the beginning of the pandemic. This vaccine will also combat the highly contagious Delta variant. Pediatricians are hopeful that the vaccine will reduce the number of child COVID cases.
8,400 of them have been hospitalized. So there's an urgent need for vaccination. I am a parent of school-age children, of 7-year-old twins, and I recognize that this is a difficult choice for parents to make. But for me, the calculus is simple. This is the easiest way I can keep my kids safe.
The White House COVID-19 task force encourages parents of kids 5 to 11 to vaccinate their children as quickly as possible to reduce the spread of the virus within U.S. schools.
After almost 18 months of anxious worrying every time your child had a sniffle or started to cough, well, you can now protect them from this horrible virus, because that would always worry you that was coming along. 28 million more young Americans are now eligible for the protection of a vaccine.
Parents have spent the last 18 months concerned about the health and safety of their children, and now they may have a vaccine for kids that has a 90% effectiveness rate for combating the virus.
I'll feel maybe stronger now that I have the vaccine, and maybe I get to do more things.
It'll make life that much easier to be able to take the kids places, to not feel so worried about, do we have a mask, do we not have a mask?
As the federal government continues to roll out vaccine mandates, it is expected that state school systems will require children to be vaccinated. From Washington, Maria Bird, Channel Television News.
And staying in the U.S., according to an article by Pulitzer Prize-winning journalist Michael Haltzik, full origins tracing report released by U.S. intelligence agencies effectively demolishes the lab leak theory as the COVID-19 origin. He says believers of the lab leak hypothesis had their hopes dashed as the assessment failed to validate their suspicions. Following a brief summary in August, the full report was released October 29, which avoids offering a firm conclusion on whether the novel coronavirus was originated from nature or leaked from a Chinese lab, but it provides details on how the assertions that support the lab leak theory are wanting. Dr. Mercia Dionwe, internal medicine and hospitalist, joins us from Texas in the U.S. To talk more about this. Thanks for joining us on the program. What's your take on the origins of the virus, COVID-19?
Well, thank you for having me. My take is we still don't have a definitive way or knowledge of exactly how COVID-19 came about in humans. We just know that there is a virus very similar to COVID-19 in horseshoe bats that have been seen in Wuhan, China. And so how that similar virus now suddenly mutated to COVID-19, or how COVID-19 originated from that, is what we don't know. There are talks that there may have been an intermittent animal called a peglion, which is like an anteater that can be sold in wet markets, particularly seen in Wuhan, China, that may have been the vector that may have mutated the virus in which humans got it. But these are all speculations. So I'm curious to see when we'll find this definitive answer, but as of yet, it's still speculative.
And another question is the role of the WHO in all of this, because there is an angle that the lab leak theory originated with a clutch of anti-China perception in the State Department under former President Trump. So, I mean, the claims are from bioweapon to a lab leak there. But do you think that we will come to the bottom of, indeed, where the virus came from at the end of the day?
I mean, I hope we do. I mean, like you had just mentioned, there is a political aspect to all of this. And it didn't help that in the beginning when COVID emerged that, you know, China was a little bit secretive in terms of information. And so I feel that that helped propagate why people were thinking that there was a lab leak. But I think as we start to investigate, as people are starting to tease out, leaders of the world are starting to tease out, the World Health Organization are starting to tease out information, that we will soon come to know what exactly happened. But so I think patience would be the key in this case.
All right, let's go to U.S. health officials, you know, given the final sign-off, Pfizer's kid-sized COVID-19 shots, a major expansion in the country's vaccination campaign. Tell us, is it a different size type from what the adults are taking?
Yes, you're correct. From what the Pfizer study has shown, they've actually are giving 1/3 of a dose of the adult form of COVID vaccination, so about 10 micrograms. And they've shown that when they give those doses, as reported earlier, that there is about a 90% effectiveness of prevention of COVID-19. And they're also noticing not as severe adverse effects. And so that's currently what the children here in the U.S. are getting.
And that is the concern about the myocarditis, the inflammatory heart condition.
Correct. So, and what they're noticing in that particular study as well is they haven't really seen any cases of myocarditis in children as of yet. Granted, the study sample size was small and they're continuing to monitor it, but so far they haven't seen any cases of that. Some speculate that the reason why you see it in adolescents is this myocarditis not only is tied to the vaccination, but because adolescents tend to have higher levels of hormones due to puberty, that may also be linkage to that myocarditis condition. But it's interesting to know that so far, even though there are myocarditis cases in adolescents, there still hasn't been a death as reported as a result of that condition.
Let's talk about last weekend, an Alberta member of legislature saying COVID-19 protesters came to her house, hung up a noose. I mean, quite disturbing, the threats and intimidation from protesters who feel COVID-19 isn't real.
And see, that's the problem that we're having here in the States. The idea of misinformation, the idea of misinformation just propagating a lot of these protests. Because I mean, for me, because of how it was initially handled and how it became politicized, you're having these demonstrations, and it's not doing anything good as far as cases. It's allowing the COVID-19 virus to continue to reign in the population. So I think the American people need to calm down just a little bit and let's go to the facts. What exactly is COVID-19? What can we do to prevent it? And what it is to keep our family and ourselves safe.
Dr. Mercy Dionwe, hospitalist, internal medicine. Always a pleasure. Thank you for joining us.
Thank you so much.
And Germany has recorded almost 34,000 daily COVID-19 cases in the past 24 hours, the country's highest number so far. The country is yet to vaccinate at least 16 million more people. This comes as the World Health Organization warns of a possible 500,000 more deaths in Europe by next February. Here's more on the global update.
In light of the rising number of cases in Germany, the health minister, Jens Spahn, has once again called for the check-in and upholding of the 3G or 4G rules. During a news conference, Mr. Spahn said he was asked for his vaccination certificate in Rome more often in one day than in Germany in 4 weeks. Official figures show that about 2/3 of Germany's population has completed its first round of vaccination. He called on states to reopen vaccination centres as pressure grows to administer booster shots. Meanwhile, the World Health Organization's Europe head says countries must work harder to prevent COVID-19 from spreading further as deaths and new cases surge in the region. Current transmission rate in 53 European countries are of grave concern, and new cases are nearing record levels, worsened by the more transmissible Delta variant of the virus.
Today, every single country in Europe and Central Asia is facing a real threat of COVID-19 resurgence or already fighting it. The current pace of transmission across the 53 countries of the European region is of grave concern. COVID-19 cases are once again approaching record levels, with the more transmissible Delta variant continuing to dominate transmission across Europe and Central Asia.
The United States has begun administering the COVID-19 vaccine to children aged 5 to 11, the latest group to become eligible for the shots that provided protection against the illness to recipients and those around them. Britain has become the first country in the world to approve a potentially game-changing COVID-19 antiviral pill jointly developed by Merck and Ridgeback Biotherapeutics in a boost to the fight against the pandemic. The Medicines and Healthcare Products Regulatory Agency recommended the drug be used as soon as possible following a positive COVID-19 test and within 5 days of the onset of symptoms.
Let's continue to take responsibility. Vaccines alone are not enough to keep the pandemic away. Adherence to all non-pharmaceutical preventive measures are also important. Our website is live for you. You can find it at channelstv.com. It gives you updates of the coronavirus pandemic and other stories. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.